Thanks, everybody, for joining today's briefing on COVID-19 in North Carolina. UNC TV is providing a stream for sign language on unctv.org. Well, good afternoon, everybody. As of today, we have 7,608 confirmed cases, 486 people in the hospital, and sadly, our death count continues to increase with 253 deaths. As always, our prayers go out to their families. Last month, our state took strong actions to slow the spread of this pandemic. We know that these actions saved lives, but we also know that we can't keep staying at home for the long run. Now we know what is needed to transition out of the restrictions and what a new normal will look like. This matters not just because people are anxious to leave their homes, but because this virus has hurt so many people economically. Last week, we laid out some general steps on the path forward. We need an increase in testing, more tracing, and we need our trends to be headed in the right direction. The White House shares similar guidance with states, and we have incorporated much of that guidance in our plan. After a thorough analysis of the details of testing, tracing, and trends, it's clear that we are flattening the curve, but our state is not ready to lift restrictions yet. We need more time to slow the spread of the virus before we can begin easing those restrictions. So today, I'm extending the stay-at-home order until May the 8th. This will include continued closure of dine-in restaurants and bars, as well as the same close contact businesses like hair salons, nail salons, movie theaters, and others that are in the previously signed Executive Order 120. It is important to get our economy moving, and we are helping with unemployment insurance payments, stimulus money, and many businesses that are continuing to be open. But I will not risk the health of our people or our hospitals. And easing these restrictions now would do that. This decision is based on data that we can see in our critical categories. I know people want their lives and their livelihoods back, and I have a plan to do that. But first, we need to hit certain metrics because the health and safety of North Carolinians is our #1 priority. I'll now recognize Dr. Mandy Cohen, who is our Secretary of the Department of Health and Human Services, to walk through the details of the data on testing, tracing, and trends that we are looking at, and then I will follow with the various phases that I believe North Carolina can go through once we hit the metrics that Dr. Cohen is outlining. Dr. Cohen?